a man suddenly falls to the floor, with the moment captured on CCTV cameras. In the crush of helpers, Senior Emergency Dr. Martin Dutch takes control.
You're one of the anaesthetic cons, are you?
Yeah. Sorry.
Yes, Martin, one of the emergency physicians.
1 minute, Dr. Martin is buying an orange juice. The next, he's trying to save a life.
I haven't even left the cafeteria when I look down on the ground and there is this gentleman who's collapsed. And it very much looks like his heart has stopped and the nurse is appropriately giving him CPR.
They have seconds to get the man's heart going, or he will die. Dr. Martin gives the man adrenaline to try and kickstart his heart.
We begin to see signs that this gentleman is coming back to life.
Senior Emergency Dr. Jonathan Papson heads next door to the ED to set up a resus bay.
I've lost track of exactly how many helpers. Myself, multiple anaesthetists, doctors from ICU, excellent nursing staff from the wards, all coming together to try to save this man's life.
All right, everyone's happy? 1, 2, 3, yep.
What he doesn't need to be is in the middle of a cafeteria floor. We need to get him to a place where we can take better care of him.
All right.
He's got a radial pulse.
Good.
This gentleman, even though we've restarted his heart, I don't know who he is, I don't know what medical problems he has, and I don't know why his heart stopped in the first place.
An adrenaline infusion, I imagine.
We're lucky it happened in the hospital, actually in our Zuki Cafe, which is right next to emergency. Otherwise, he'd be dead.
Who's got my stethoscope?
It's easy to misplace things in the ED, which is why Head of Emergency, Director Dr. Mark Putland, is on a search and rescue mission.
Yeah, who's got my stethoscope? It's a mystery sometimes how a stethoscope goes missing from my shoulders because I never remember taking it off. Thank you very much.
With his stethoscope safely back, Dr. Mark heads to Resus 4, where something else is out of place.
Cheryl, g'day, Mark. Putland is my name, one of the senior doctors.
54-year-old Cheryl has been rushed in with an extremely painful dislocated hip.
What was the mechanism today? Did you lean forward and...
No, I was just sitting on the edge of the bed, using my waves-around lady thing, and my knee just turned inwards.
So you're doing your legs, or...?
Yeah.
Yeah, OK. Which hip?
Left.
She was just sitting on the side of her bed doing her work on her legs, just getting a few hairs tidied up or something. It was, so I guess, just leaning forward ever so slightly. And that was enough.
What are you doing? Are you operating?
No, he's going to pull it back in.
Ah.
Put it back in position, yeah. But we'll have to get you to sleep to do that.
Yeah.
You can't leave the hip out for any length of time. It's terribly painful and debilitating for the patient, and it's doing damage to the structures all around the joint. We pull it back in, it's just a finesse and a little bit of muscle. Or sometimes a lot of muscle and a little bit of finesse. OK, we'll get out of the way, let the X-ray guys take their picture, satisfy ourselves that we're really dealing with what we think we're dealing with. We X-ray it to be absolutely certain what we're dealing with is a dislocated hip. If she had a weakness in the joint that we didn't know about and had broken it, we would hate to be pulling hard on it and doing damage, so we always X-ray it first.
Cheryl has an artificial hip, and Dr. Mark discovers it's the 3rd time it has dislocated.
Some replacement hips go really, really well and people don't have a problem, but some people just have dislocation after dislocation. That's unfortunately how she's been running for a while now. Just bad luck. And that's what's happened there. You can see the normal hip's got the ball is in the socket, and this one, the ball's sitting up here and the socket's down here, so it's just out of the joint.
It's an opportunity for Dr. Mark to mentor junior registrar Dr. Laura Gelly, who's halfway through her emergency training.
It is a very big commitment, particularly committing to shift work. I feel like I miss a lot of dinners or events or birthdays in order to do this training, so it has to be something that I like and enjoy, and I really do. Like, I don't think I could do anything else in medicine.
Yeah, there's a bunch of different techniques. Some of them are all muscle, some of them are a bit more finesse.
Yeah.
They all kind of eventually
Get my
work.
muscles out.
We might get an extra helper just because that way I can help you with the hip, someone else can take care of the sedation. Yeah, so I'll get Dean come and give us a hand with that. I'll be back in a minute.
I have never popped a dislocated hip back into position.
Not only has Dr. Laura never attempted the technique, she has to perform it in front of the boss.
So it's shortened way up, so it needs to be pulled down. That's one of the first things.
With Cheryl being sedated, Dr. Laura can begin her first attempt at relocating a hip.
So your hand under there, that's the way. Hand holding her ankle. And just gentle tension and let Dean take care of her sleepiness, and while you just keep the tension on, gradually pull her out to length.
It's very tricky to be able to provide enough traction, and also it's the counter traction that often is the key to popping joints back in.
If you bring your hand down below the knee, the hip's a ball and socket joint, and the ball, in a case of a dislocated hip, has popped out of the socket and it's slipped upwards towards the patient's head and backwards towards the patient's bottom. So, and it's sitting behind the socket. That's good. It's moving. It's moving. Nice. She fighting you a bit?
No. The amount of force that you need to use it's so much.
You're doing the right thing. Just feel how it feels.
Cheryl's badly dislocated hip is not going back in.
It's well and truly out of place. There's not much joy there, is there?
This gentleman's hypoglycemic at 2.8 BSL.
Back in Resus Base 6, the team is desperately trying to save a man's life.
When you have a cardiac arrest, you're just about dead. And then you just have a couple of minutes, and after that, you're fully dead.
So he's been brought back from the brink. Thanks everyone for coming.
And all those lovely people who are extremely helpful needs to leave.
Yeah.
The problem is actually there's not enough room to move in this little room to actually assess him.
Let's just have the story.
Dr. Jonathan and Dr. Martin need to learn more about this man who was alone in the cafe.
2 questions. Who is this man? And why is he in hospital? And then 3rd question, why did he have that cardiac arrest?
Is it Martin? So we should sedate him and paralyse him and keep him asleep, yeah? Yeah.
I would go propofol and rocuronium.
He looks like a man who's got significant illness apart from the fact that his heart's just stopped today.
Which makes the risk even greater. The man could re-arrest in front of them at any moment.
We need to get a blood gas and a blood pressure.
The more times your heart stops, the more unlikely it is that we're going to be able to get you back.
Is she fighting you a bit?
No.
In Resus Bay 4, Registrar Dr. Laura is attempting her first hip relocation. Despite every effort, Cheryl's hip is refusing to go back in. With the hip still badly out of place, Dr. Mark takes over.
It's proving more difficult. That's not unusual with a hip. So I'm not surprised, but it's harder than... It's failed at the first hurdle. You're doing the right thing. Just feel how it feels.
The so-called easy way, working alongside the patient, isn't paying off, which means Dr. Mark has to resort to Plan B.
OK, well, we'll go to the old way.
Give her another 20.
Yeah.
Cheryl's sedation is topped up.
We climb up on the bed, we sort of squat astride the patient, one arm braced by the other, and the patient's foot sort of under your butt cheek, really, I suppose. It's a bit undignified, and then you kind of just apply a really good, strong, sustained force away from the bed up towards the ceiling. It's a bit like Twister. It ends up looking a bit like Twister. She's not in pain. We use medications that get people well and truly oblivious to what's going on. It's a bit like when you decide to be heroic and take all of the shopping out of the car and hold it in just 2 hands to look impressive to your wife, and then you realise you've parked further from the front door than you thought you had. Look, it's just about holding something heavy for longer than you'd like to.
It's pretty tough. There's nobody moving there at all.
Despite applying incredible pressure, the hip won't go back in.
Crikey.
Does that work out?
That'll be it.
So then it's my turn. When your boss is telling you to get on the bed and give it a go, you can't say no.
So foot goes under your left thigh.
Like that?
Yeah. Just put your arm right under that. Elbow on your knee.
Yeah. Oh, yeah.
And that hand can grip that.
It feels very strange to be standing above a patient on an elevated bed.
Yeah, and lift up towards the ceiling.
I'm a very competitive person in any aspect. I really want to get it in.
Keep going, keep going. Yes, keep going, just hold it there. That's good. That's it. Well done.
And then we feel the wonderful clunk that it's gone back in.
Muscles, that's what it needed, was someone with a bit of muscle. These old, bloody decrepit, nearly 50-year-old. Go on. All right.
It's the most satisfying clunk you'll ever feel. You have a little sleep. It's all back in.
The ordeal is finally over for Cheryl.
Look at his face, we're so puffed.
It's so fast. It's exhausting, isn't it?
I felt really good doing it as a junior, particularly when you get to pop it in front of your boss and he wasn't able to do it. Yeah, I can rub that in his face maybe a little bit.
Let's fix the airway. Circulation's all right.
Yeah.
Over in Resus Base 6, Dr. Jonathan and Dr. Martin still don't have the information they need to treat a man who's clinging to life after a cardiac arrest.
And he's still at significant risk of his heart re-stopping again.
Can you listen to his chest? Tell me what his chest sounds like.
There are many different causes of why somebody's heart stops suddenly. Understanding a little bit about this gentleman and what his previous medical history is will direct me on what is the more likely cause for why his heart stopped.
You know, someone knows this guy from today.
He's in the cafe, he's in the hospital. Is he a patient of the hospital?
And he was hypoglycemic too, wasn't he? So what's all that about?
So we're looking for clues.
So, and he's got a fistula. Looks like it's been accessed. So that's a new access to fistula. Maybe he's just had dialysis.
All I know is a renal patient.
We realise he's a renal patient because he's got a fistula in his arm. So that's a good clue.
It's more than a clue. It's the breakthrough the team has been looking for.
Let me do the ultrasound.
Using hospital records, they discover the man in front of them is 46-year-old Andrew, a regular dialysis patient.
We're like detectives. Sherlock Holmes, the guy who wrote Sherlock Holmes, he was a doctor, wasn't he?
They didn't pull off a gas or anything. No, but they got a sugar. Yeah.
I'm listing the likely culprits for his arrest. And every time I get a bit more information, that little list might change in my mind. I might put another one up to the top. Okay, actually, maybe that's the main thing now. I'm hearing some new bit of information. Maybe I need to slot that diagnosis to the top.
Dr. Martin begins looking for possible causes, starting with a chocolate the man was eating and a possible choking fit.
I'm expecting to see just a normal airway, however, maybe with some foreign body present.
Got some suction for him?
Yeah, it's my left.
Yep. It doesn't look like there's stuff in there.
No.
With choking ruled out, Dr. Martin continues to build a picture of other likely causes.
Now we know that Andrew has in fact got diabetes, and he's also a dialysis patient. Kidney dialysis patients are more likely to have narrowing of the blood vessels to their heart, but they're also more likely to develop problems in removing salts from their body, such as potassium. And when these salts build up, they can cause the heart to stop.
So the next thing would be, once we're in, we need to ultrasound in what's going on with the heart, what's going on with the lungs.
If you want me to stop ventilating at any stage, let me know.
That's the heart in the middle, and the outline of the heart's pretty much as we would expect. There's probably a little bit of fluid in his lungs, which you can see in this situation, but that looks all right. Just doesn't help me, essentially. Just reassures me, doesn't help me.
The team has tracked down Andrew's elderly father, while Dr. Jonathan and Dr. Martin try to stop Andrew from having another deadly episode.
It's not like he's out of the woods by any means. I'm really worried that Andrew's going to have another cardiac arrest because I haven't found the cause.
So the problem is still there as far as I'm concerned.
And this will make them happy.
Emergency Dr. Emma West juggles both a career in the ED and raising 4 children.
I've worked at Royal Melbourne since 2007. I arrived here pregnant with my second child, and I like doing my best to help whatever comes through the door.
How old is your baby?
Almost 2.
Yes.
Dr. Emma and Dr. Michael Dunn take a rare moment to catch up on family news.
The tantrums are starting.
Oh, okay.
God.
Oh, it's so cute when they do that.
So she went to daycare, and 2 weeks into daycare, this new thing happened where she lay face down on the ground and started kicking her legs in the ground. So I just walked away. And then she realised I wasn't there, and she got up
Yeah.
and she was fine.
And then you go and give her a big cuddle
Yeah,
later.
yeah.
Beautiful.
Dr. Emma gets notification of her next patient.
I've got Vittorio. Vic, why have you come in today?
Basically, the entire left side of my body is numb.
And how long's that been a problem for?
Around 9 days.
Okay. And you've been to hospital twice, but it's getting worse. Is that right?
Yeah.
Yeah.
Vittorio's got numbness on one side of the body, and that is really abnormal. It's a really abnormal feeling, and he made the right decision in coming to see us today.
So the first day I noticed when I got out of bed that my foot was numb. And then I kind of just ignored it. I was like, yeah, whatever, it'll go away. And then the next day the numbness spread up to below my knee. And then I went to hospital to get it checked up. Yeah, they did some blood scans, they did some CT scans, and I got an X-ray on my back as well, and everything came back normal. And then today I woke up, and then that was when the numbness spread up to my face, and then that was when I thought, better come in again. So I'm back again.
Vittorio's 21. He's about 6 years older than my son, and I look at him alone and I kind of see, that young man ready to start his life, and I can't help but think of him in the same way that I think of my son, just wanting the best for him, wanting him to have nothing wrong with him, but knowing that there probably is something wrong with him.
I don't really do anything. I'm a bit boring. Like, I'm a medical science student.
Vittorio mentions he's lost 6 kilos in the last 2 weeks.
And do you feel like you look different after losing weight, or not really?
No, not really.
No. Did your mum and dad notice?
I don't think so.
No.
I've started to ask him a couple of screening questions to look for causes, including cancer, asking about weight loss and sweats at night.
And so you felt hot at night, but not drenching sweats?
Yeah.
Yeah. But different to normal, you think?
Yeah.
Yeah.
And to my surprise, he has had quite a significant amount of weight loss, which does make me more worried about possible problems such as lymphoma.
Vittorio stays in close contact with his parents, who aren't able to be with him today.
And he's regularly updating them. They know something's wrong, and they're really just trying to seek those answers of what's going on with their son.
I'm a bit worried. Yeah. Just want to get some answers and know what it is.
The hospital, you have to leave for the lab and go off.
On the hospital rooftop, air ambulance is arriving from Victoria's Gippsland region, carrying a young man with an horrific injury.
Actually, do you mind calling X-ray and asking them to come over?
Dr. Caitlin Young is leading the trauma team. The emergency registrar is following in her parents' footsteps with her medical career.
Both my parents are, in fact, doctors. Growing up, you were very well looked after, but we always would say that if you were conscious and you weren't bleeding and it wasn't gushing, then you wouldn't be getting any sympathy. We've got a gentleman we believe is about 22 years old. He's been in a motorbike accident and it sounds like he's run into one of the wire barriers. Initially, he had quite a low blood pressure, which makes us worried about serious injuries, but it also sounds like he might have nearly cut off his foot, which is why we've spoken to a few different teams. We need to get things rolling quite quickly in terms of saving that foot.
Emergency Dr. Michael Dunn is here to assist.
Probably about 5 minutes away, I think. I'm absolutely delighted I chose emergency medicine. It's definitely the right specialty for me, and I get to help people at their most scared times.
So, Michael, just while you're here as well, so it's a motorbike accident, 40, 50 k's an hour through a wire barrier. So plastics, ortho and vascular are all aware. So we're going to bring him across and then we'll do our handover up this end.
All right, everyone ready? On the count of 3, 1, 2, 3.
So this is Josh. Josh's a 21-year-old male. He was riding a motorbike this afternoon, went to overtake a car, and he's managed to send himself through a mesh fence that surrounds a construction site.
Yep.
He's literally gone through it.
Yeah.
Over the handlebars, resulting in what looks like a posterior fracture dislocation, partial amputation of that left foot.
Yep. There's been no airway or breathing problems at any stage. There's been one episode of hypotension initially with a systolic blood pressure of 90. It's resolved with no treatment.
Doc, anything in this ankle hurt? Well, that's okay. Is anything sore? Feel me touching you both sides? Is that the same? Is that the same?
Josh's phone is missing, which is making it hard to contact his parents.
For Josh to be able to speak to his parents, for his parents to know where he is and what situation he is in, that's really important. It's not going to change what we do medically for Josh at the moment. It's not going to change how we care for him. But I think for both for Josh and for his parents, it would be the best thing if they could talk to each other.
You all right, man? Yeah? You okay? Yeah, it's all right. Someone like Josh has come in with a serious injury, must be terrified, because almost all our trauma patients are stuck in a collar and they're just looking at the ceiling and hearing all these noises around, people touching them, pulling at them.
We've got this open fracture dislocation, amputation of the left foot. How are we going with assessment of that?
Plastics and ortho talking.
Just discussing?
At the moment.
Great.
Orthopaedic and plastic surgeons examine Josh's mangled foot, preparing themselves for what will be a mammoth effort to reattach what's left.
Josh's foot injury is as serious as it gets. He just looks terrible. He's got poor blood flow to the foot. The nerves that supply the foot appear to be damaged, and the bones are broken through, and it seems that he has his foot just hanging on by some tissue at the moment. It's probably one of the worst foot injuries I've seen.
I know your foot's sore, okay? We'll give you some strong painkillers now, all right? We're going to give you some strong painkillers now.
Okay, so we're going to do the chest x-ray, if everyone can just step back.
The 21-year-old could be paying a high price for a stroke of bad luck on his motorbike today.
What we're worried about is blood flow to the foot, and if the blood flow is interrupted too long, worst case it can end up being amputated completely and they can lose the foot and then end up needing like a prosthetic foot, which would be really life-changing for a young man like this.
Diabetic Andrew, who had a cardiac arrest in a cafe at the Royal Melbourne, is being scanned for clues to try and solve the mystery of why his heart stopped.
What's it going to be? I can't believe he was so hypoglycemic that he arrested.
No.
Every question I ask, I'm getting another series of questions. It's a can of worms that keeps opening up with this gentleman.
So far, they're no closer to pinpointing the cause.
His blood pressure's fine. He's not febrile, is he? No. So we went to CT to make sure Andrew didn't have a complication of the arrest, like a stroke or a brain hemorrhage or something like that after falling. He's not bleeding internally. So what's the cause?
Andrew's mystery collapse is the talk of the ED.
brain normal, doesn't really help, does it?
That's one of the things I really enjoy about emergency, actually, is bouncing ideas off people and getting their opinion.
And he maintained good sats and all of that sort of stuff. So, yeah, I
How puzzling.
But he was only in ICU, like, a handful of days ago.
Right.
He's not a well man.
No.
Andrew is now being admitted for more tests.
And one of the best tests is time and just watching and see what happens. But look, my main goal here is to make sure that one of those big bad causes of cardiac arrest isn't there, and it's not going to happen again. He's not going to re-arrest.
The 46-year-old is being closely monitored.
Well, do you want to get an EDA and I'll just check whether it's ordered? Are you getting it?
Doctors also discovered Andrew lives with his parents and has been a type 1 diabetic since the age of 5.
Sometimes the pieces of the puzzles don't fit together in emergency, but eventually they'll get sorted out. We have a limited time with the patients in general. We'll label big picture issues, but there's a lot of stuff that will need to happen with someone like Andrew to actually work out what the cause is and what the overall therapy is.
For now, Andrew is safe. The most important thing is the hospital saved a life today.
Andrew happened to be in a middle of a hospital where bystanders saw that there was a problem, started CPR and asked for help. And that's what saved Andrew today. I was just the cherry on top at the end of that line of people to come and give Andrew a hand.
We got a valve mask, back up. Sorry mate, put this on, okay?
Over in Trauma 2, doctors Caitlin and Michael are trying to save Josh's foot, which he nearly lost in a motorbike accident.
Our next priority is to reduce the left ankle to improve the perfusion from there. So at the moment, we should be focusing on setting up for sedation. The perfusion that we're referring to is the blood flow to the foot. So what we're doing here is that we're going to move the foot, get the bones into a better position and hopefully improve the blood flow to the foot and reduce its risk in terms of needing amputation.
What's happening? At the moment, we're going to give you some sedation.
So your foot's a bit broken, you know that, yeah?
Huh?
So your foot's broken. I'm pretty damaged. I know your foot's sore, okay?
One of Josh's broken bones is piercing through the skin, and doctors have to push it back into place. Dr. Michael is in charge of administering the sedative ketamine to Josh, so orthopaedic specialists can realign the broken bones.
And I'm up here to make sure that your breathing is all right, okay? But you're in a safe place, in safe hands, all right? So you just chill out and relax and we got you.
Not sedate me?
Don't worry, it's happening now. I just want you to relax, think of a happy place, okay? You're gonna drift off to sleep soon and the pain's gonna go away.
50 milligrams in.
Close your eyes.
I'm talking to Josh. I'm just trying to reassure him, trying to let him know everything is okay and everything's under control, because he's had the last 30 minutes of his life being completely out of control and not knowing what's happening.
Close your eyes. Yeah, I think we should be okay.
If you just commence slowly by lifting up the limb.
Deep breath in and out. Big breaths.
So ketamine is a drug that we use quite a lot in the emergency department, probably more than anywhere else in the hospital. And the beauty of ketamine is that it can keep the patient awake, but give them an out-of-body experience. So there's what we call dissociated. They're not quite there, but they're still breathing, eyes are still open, and it allows us to do painful procedures.
Big breath. Good, good. Good, man. That's okay. Big breath. In and out. Big breath.
The bones are closely realigned again, but there's still so much more to do to try and save Josh's foot.
I think you sometimes realize in the job just how one slip up or one mistake can be so devastating. And we see the consequences of that. I think it's probably why you find a lot of people in the ED, very few of them ride motorbikes, very few of them, take sort of those high-risk activities is more because we see the mistakes, we see the unlucky ones, the ones who just have that really bad luck come through our front door. And I think that's what's happened with Josh, and potentially could lose the foot because of it.
How is he going, do you think?
I think he'd go about 5, yeah.
I think it'll only be a couple of minutes. So essentially at the moment we're just confirming he's safe after his anaesthetic to go to CT, and as soon as we're ready, CT's ready. They're waiting for us. Could you prepare them while we're around? That'd be great.
21-year-old Josh is headed to the CT scanner.
We've been able to give him some medication to make him sleepy, relieve his pain, put that foot back where it's meant to be. And now we're just doing scans to look for other serious injuries and assess the blood flow to his foot.
Count of 3, rolling, 1, 2, 3. Everyone back, 2, 3.
Josh, this is for your CT scans, okay, mate? The place where his injury is involves some of the quite significant blood vessels going to the foot. So not only is it open and so there's a severe risk of infection, we're worried about the blood flow. And really, if either of these things go badly, he could end up with an amputation of his foot. And that would just be absolutely devastating for a young man, or anyone, but particularly a young man like Josh. So the first scans are just looking through the quick pictures of his brain scans. No signs of a serious brain injury, and now we just progressively go through the rest of the body. Looking at his foot though, we're worried about reduced blood flow because we can see that it looks white in colour and the blood flow doesn't come back into it as quickly when we press on it. So we are worried about the blood flow to his foot. Well, we'll just get the results. We'll just have a look.
Dr. Caitlin updates Josh on the next step.
So Josh, you're just getting the rest of your results from your scans, okay? What we know at the moment is that you've got a severe injury to your foot, so it's sort of half cut off, and they need to put it back in the right place. Yep. Okay, they're going to talk to you more about that because you'll need that operation to get that foot in a good spot. Mm-hmm. Is there someone you want me to get a phone, do you want to talk to them? Do you want me to call them to let them know you're here and what's going on?
Yeah, my mum.
Your mum? Yeah, okay.
My dad.
Yeah. Do you know their number?
I don't.
Okay. Do you know any of the phone numbers of anyone in your family?
No.
No. Okay. I often hold patients' hands when I'm looking after them in the emergency department. I think it's a real privilege that we have to be there, and that human touch, the holding of someone's hand, is a very basic thing, and it's a real sign that I'm here with you, I'm here to support you, you're not alone. And I think it's really reassuring in terms of we are going to look after you. Got any other questions at the minute?
Can I go to sleep and wake up better?
Well, you'll go to sleep and wake up after your operation. You just won't be completely better. You'll still have lots of recovering to do though, okay?
Yeah.
It's going to take you a while to get better from this one.
Am I going to keep my foot?
They need to have a real look at it yet, so we don't know. How are you with needles? We're about to find out.
21-year-old Vittorio is undergoing a barrage of tests, starting with blood analysis for numbness down the entire left side of his body.
He's presented with 9 days of progressive numbness on his left-hand side.
Dr. Emma is discussing his case with a neurologist.
He lives with his mum and dad, no recreational drugs. He's a medical science student.
This is the second time Vittorio has gone to hospital. The first time, all the tests were clear. Dr. Emma is repeating the tests to make sure nothing has been missed.
So interestingly, he's lost 6 kilos in the last 2 weeks, just thinking about other causes, including something like a lymphoma or something like that. But he's not eaten differently. He doesn't really understand why. I think he will need an admission to sort this out. Would you agree? Will I book a neurology bed? Yeah. Yeah, sure, perfect. I appreciate it. Yep, no problem. Good on you. Thanks for seeing him. Bye.
For the medical science student, it's all a bit of a shock. The numbness has come out of the blue.
I haven't had any problems as bad as this. This is a bit bad.
Vittorio has a look on his face that says calm, but there's also, just below the surface, there's that, worry.
Along with Vittorio seeing a neurologist, Dr. Emma is keen to see what a CT scan tells her.
What I'm looking for is, or hoping not to see, is, a brain cancer, a brain tumour. Also, there could be other causes, including strokes, less likely for a young man, but certainly not unheard of.
The CT scan shows that there's no mass in the brain, which is good, so no cancer in the brain, but he needs more testing.
The medical science student and Dr. Emma are preparing themselves for another possible cause for his numbness. And it could be life-changing.
And the next type of scan that he'll need is an MRI. That will look at the brain in much more detail and in particular address whether or not it could be multiple sclerosis as the cause of his numbness of his body. I think for any young person to be faced with a chronic medical condition, that's what Vittorio's facing now. It's pretty confronting.
Nine days ago, 46-year-old diabetic Andrew collapsed in the hospital café from a cardiac arrest.
I haven't even left the cafeteria when I look down on the ground and there is this gentleman who's collapsed and the nurse is appropriately giving him CPR.
He was brought back to life by senior emergency Dr. Martin and the team.
So this gentleman's an outpatient who's had an unconscious collapse. He's hypoglycemic at 2.8 BSL.
Andrew has made an incredible recovery from his near-death experience.
Other than the sore chest where they gave me CPR, I feel fine.
While doctors weren't able to pinpoint the exact cause of Andrew's cardiac arrest, he's thankful to the team who saved him.
If it wasn't for them, I wouldn't be here.
Andrew is looking forward to going home where he lives with his parents.
If it wasn't for my parents, I don't know what I'd do.
Medical science student Vittorio came in with numbness down one side of his body.
Vittorio's 21, he's ready to start his life. And I see, that young man just wanting the best for him, wanting him to have nothing wrong with him, but knowing that there probably is something wrong with him.
Concerned, Dr. Emma scanned him, suspecting it could be cancer or multiple sclerosis.
The CT scan shows that there's no mass in the brain, which is good, so no cancer in the brain, but he needs more testing.
I'm a bit worried. Just want to get some answers and know what it is.
The results were inconclusive, and while the numbness has gone away, Vittorio is having ongoing tests. Cheryl was rushed in with an extremely painful dislocated hip.
There's not much joy there, is there?
The director of the ED, Dr. Mark, tried unsuccessfully to pop the hip back in. Then, Registrar Dr. Laura had a go.
That's it. Hey. Well done. Muscles, that's what it needed, was someone with a bit of muscle.
Cheryl was able to go home. And Dr. Laura has a new name.
Dr. Putland has called me the hip whisperer on our registrar teaching, which is very embarrassing. Look at his face, we're so puffed.
He's so puffed.
Sets a precedent now. I've got to try and maybe I should just go out, no more hips, go out on a win.
21-year-old Josh almost sliced off his foot in a motorbike accident.
I know your foot's sore, okay? We'll give you some strong painkillers now, all right?
Josh's foot injury is as serious as it gets. The nerves that supply the foot appear to be damaged. The bones are broken through. It's probably one of the worst foot injuries I've seen.
Even as he was being wheeled into surgery, there was no guarantee he would keep his foot. A huge team of surgeons saved his foot in a marathon operation.
They were considering an amputation, which was a bit scary when they told me, and that was probably one of the biggest moments of relief for me. Had a bit of a teary after that.
Josh went on to have 7 more operations to replace skin on his heel, which continued to peel away and die because of lack of blood flow.
This was my tissue graft. The tissue graft they used on my foot, and they took the skin graft to put skin over the tissue because that was otherwise just bare muscle. There's no skin on your body that's the same as your heel. The thigh doesn't do that. It's very soft tissue, so it's going to feel, they've told me, quite weird when I finally start walking on it again. It's going to feel very soft.
The young printer is looking at 12 months recovery, but there's no certainty how well his foot will heal.
And very, very unlikely, but possible that in the very far future I could lose it still. If it becomes too much of an issue with the arthritis, being that I can't use it at all.
Despite it all, the 21-year-old is still in love with motorbikes.
Riding a motorbike is definitely one of the best feelings in the world. Just that feeling of being free is amazing, and I'll definitely be getting back on a bike